This was an oral presentation where we looked at a pooled analysis of Defibrotide efficacy in adults across numerous studies. The pediatric data with Defibrotide is really quite striking. I think as I talk to my pediatric colleagues in bone marrow transplantation, Defibrotide's value in treating VOD and now as a prophylactic strategy appears to be very, very well established. And I think we all recognize it's obviously the only approved agent for the treatment of severe VOD, SOS as we call it, and it's clearly proving its mettle in that area, particularly in children. This analysis is to look more at the adult population and say, in this very large experience, what are we seeing? And the good news from the meta-analysis is that actually there's a very consistent signal too, that we're seeing good efficacy for the treatment and reversal of severe VOD. We're seeing a very consistent safety profile, which is very important. And I think it provides a nice platform as we think about bringing Defibrotide earlier. By that I mean it's preventive strategies, both in children in particular and in adults. And at the same time, we think about expanding indications. There's work led by my colleague Vincent Ho looking at thrombotic microangiopathy. Pivotal studies are planned in that area for approval. There are other strategies looking at reducing graft-versus-host disease that are currently under study, as well as moving into non-transplant areas as well. So I think this whole concept of endothelial dysfunction during transplant is particularly important, and obviously we're very pleased with how Defibrotide's performing. So this particular analysis helps sort of validate that in a very organized way.